Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatrician bestie, Dr. Rachel Georgopoulos, who is a pediatric ENT physician and director of the Pediatric Thyroid Hope program at the Cleveland Clinic. She also attended medical school with my husband, so this is a very special episode for me. All right, so today we are going to talk about indications for tonsillectomy, and specifically we'll talk about recurrent strep throat. The clock is ticking, so let's get to it. All right, Rachel, we know that some children get recurrent strep throat. Can we talk about how many episodes of strep throat are considered too many and might prompt the consideration for tonsillectomy?
So the studies that we've done have shown that 7 episodes of tonsillitis in 1 year, 5 in 2 years in a row, so 5 and then 5 the following year, or 3 episodes 3 years in a row, 3, 3, and 3, is considered an indication for taking your tonsils out.
Got it. And so obviously we're going to be talking about a tonsillectomy, but are there any alternatives to tonsillectomy that we can try first for those children who do get these recurrent episodes of strep?
Yeah, besides tonsillectomy is treatment with oral antibiotics and just good hand hygiene.
All right. So what does tonsillectomy surgery involve? What does the recovery time look like? Let's talk about the actual procedure.
A tonsillectomy is a procedure, it's done through the mouth, so you don't see any external incisions. The surgery itself, I usually counsel people that the risks are the risk of bleeding, which is 2 weeks. It's expected to have a pretty bad sore throat for that time, some pretty bad smelling breath. The recovery time, like I said, is about that 2-week time frame. You're fully recovered in about a month, but most people are able to return to daily activities, exercise, etc., in that 2 weeks.
So I remember growing up, there was this idea that if you got a tonsillectomy, you'd be basically living on ice cream for for a few days. Is that a real thing?
You know what? People like ice cream because it's cold and it's soft. I usually tell people they can't eat anything hard or sharp, but they can have regular food and not just ice cream, although the ice cream is a real benefit to having your tonsils out.
So are there any potential risks or complications associated with tonsillectomy?
The major ones are the risk of dehydration because the throat hurts and that risk of bleeding. Bleeding risk is about 1 to 5% and can happen anytime within that 2-week time frame.
And finally, does a tonsillectomy guarantee that a child will never get strep throat again?
This is a great question. No. And actually, we've seen a rise in this. I'm not sure why, but I have had patients who've had their tonsils out and they get strep pharyngitis. Obviously, they don't have their tonsils anymore, but you can get strep throat, technically, still, even if your tonsils are taken out. Now, I will tell you that this is a lot less frequent, but you can still get strep infections.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.